estimated that most of this plan can be paid for by finding savings within the existing healthcare system. Money that's already being spent, but spent badly, wasted, and abused. Right now, too much of your taxpayer dollars and too much of your savings, frankly, are spent on healthcare that doesn't make us healthy. That's not my judgment. That is the judgment of medical experts and doctors and nurses. Healthcare professionals all across the country. We love nurses. I love them. As I said on Wednesday night, this is also true when it comes to Medicare and Medicaid. And Medicare is one of these issues that has been, really distorted in the debate. So I spoke directly to seniors on Wednesday. I want to repeat what I said. We have stood up for 4 decades for the principle that after a lifetime of hard work, our seniors should not be left to struggle with medical bills they can't pay. Medicare was born. It remains a sacred trust. It needs to be passed on from one generation to the next. That's why not a dollar of the Medicare trust fund will be used to pay for this plan. Not $1. We will not be lowering benefits for senior citizens. The only thing that we will be doing is eliminating hundreds of billions of dollars of waste and fraud, as well as subsidies that are going to insurance company HMOs. The other thing we want to do is we want to create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. And that's going to ensure that Americans, seniors, get the benefits that they've been promised. We'll ensure that Medicare is there for future generations, and we can use some of the savings. And here's the best thing, and this is important especially for Minnesota. Because Medicare is such a big part of the healthcare system, making that program more efficient can help usher in changes in the way that we deliver healthcare that reduces costs for everybody. We have long known that some places, including Minnesota, offer high-quality care at costs below average. Look at what the Mayo Clinic is able to do. It's got the best quality and the lowest cost. That's about any system in the country. So what we want to do is we want to help the whole country learn from what Mayo's doing. We want to help the whole country learn some of the good things that are going on in Minnesota. That will save everybody money. The commission can help encourage the adoption of common sense best practices. Everything from reducing infection rates for hospitals to helping teach doctors how to work together so when you go to the doctor's office, you don't have to take a test each time you see a doctor. You take one test and they email it to every doctor. Common sense stuff like that. Now, this is the plan I'm proposing. It incorporates ideas from Democrats and Republicans. And I'm going to keep on seeking common ground in the weeks ahead. And I've said to everybody in Congress, if you come to me with a set of serious proposals, I'm going to be there to listen and my door is going to be open. But I also said, some of you heard me on Wednesday night, I will not waste time with people who think that it's just good politics to kill health care. I'm not going to allow the special interests to use the same old tactics to keep things the way they are. I'm not going to let people misrepresent what's in my plan. I will not accept the status quo. Not this time. Not now. Minnesota, we are closer to reform than we've ever been before. But this is the hard part. This is when discipline the special interests and the insurance companies and the folks who think, you know, this is a good way to bring Obama down. This is when they're going to fight with everything they've got. This is when they'll spread all kinds of wild rumors designed to scare and intimidate people. That's why I need your help. Some of the pundits in Washington have been saying, well, maybe you've been trying to do too much. Maybe you've been pushing too far, too fast. And I tried to remind them, I said, listen, I never said change would be easy. Change is hard. It's always been hard. When FDR decided that Social Security was something that seniors needed, when FDR introduced Social Security, you know what happened? They called it socialism. But senior citizens decided that, you know what, if I've got some protection in my golden years, that's something that's worth fighting for. When Medicare was introduced as an idea, they said there's going to be a government takeover of Medicare, but imagine what seniors would be dealing with right now if they didn't have Medicare. Every time we've made progress, it's because ordinary people banded together and they stood up and they said, we've got to make progress. And we're going to push and we're going to prod until Washington finally reacts.